There are two types of asthma medications: relievers and controllers. All children with asthma will be prescribed with a reliever medicine for use during asthma attacks. Some children whose asthma is not well controlled may need to use a controller or preventer medicine daily. Relievers are medicines that relax the muscles around the airway, which make breathing easier and provide quick relief of symptoms. However, they do not modify the underlying disease. They are often used on an as-needed basis. Symptoms such as coughing, shortness of breath, and wheezing will usually be relieved within minutes. However, relievers do not have a long-term effect. Remember, relievers should be carried at all times, even when going to school, and are to be used only when needed. Examples of relievers are bronchodilators, such as salbutamol, Symbicort, and Bricanyl. Seek medical attention if there are symptoms requiring salbutamol every 4 hours, or more than 6 or 8 puffs of Symbicort per day for more than 2 days. Your child needs salbutamol every 3 hours or more often. When your child is feeling bad, his asthma is getting worse fast, the reliever medicine is not helping, or when his breathing is hard and fast. Controllers are medicines that reduce the inflammation or swelling of the airway lining and reduce mucus production, making them less sensitive to triggers. They do not provide immediate relief of symptoms, but treat the underlying disease. Controllers need to be used daily if prescribed by the doctor and should only be stopped when advised by the doctor. The period of treatment for each child can range from many months to years, depending on the response and control of your asthma or that of your child. Examples of controllers are Flixitide, Pulmicort, Montelukast, Seretide, and Symbicort. Once asthma treatment has been started, ongoing decisions are based on a cycle to assess, adjust treatment, and review response. Asthma is a variable condition, and periodic adjustment of controller treatment by the doctor may be needed. We would like to thank the following for their contribution.